episode has been brought to you by Schedulicity.
And this episode is also brought to you by the Mama Nurture Prenatal Yoga School. Learn to teach fertility yoga, prenatal, postnatal, and baby and me yoga with confidence. To find out about our online or in-person trainings, visit mamanurture.ca. And don't forget, we spell mama, M-A-M-A. So that's mamanurture.ca. So welcome to episode 134 of the Connected Yoga Teacher podcast. I am so excited that you're here today, whether you are a returning listener or if this is your very first episode, welcome. I'm your host, Shannon Crow. I'm a mom of 3, a yoga teacher, and a trainer and consultant who works for yoga teachers. And this podcast was created for you, because I really had this vision of how can yoga teachers connect to the information and inspiration that they need every single week and feel supported. Because I know that when you leave a YTT and you're out there as a business owner, an entrepreneur, a yoga teacher, running your business, it can be really mucky and really hard and really isolating. So that is why this podcast is here for you. This week, we have more pelvic floor goodness coming to you. So back in episode 121, I talked about why I'm super passionate about pelvic health. And then we had Marie-Josée Forget join me on episode 129 to give us a real crash course on the pelvic floor. Last week on episode 133, I spoke with Dr. Casey Denenhauer on how the pelvic floor is related or can be related to sexual dysfunction, and particularly painful sex. And this week, I'm so excited to be able to share this interview with you with Julie Wiebe, where we talk more about pelvic health for pregnancy and beyond. And when I say and beyond, I really want to be clear that I think postnatal means after you've had a baby. So all of the time, I don't think it's just 6 weeks after you've had a baby. I'm so curious what you consider as postnatal. Now, there are a lot of myths out there around pelvic and abdominal health during pregnancy and postpartum, and Julie busts through some of those common misconceptions. So if you've ever wondered, what about that recovery time after birth for my prenatal yoga students? What do I need to consider once they're postnatal? What is the importance of breath, and how can we use this information to really regulate that intra-abdominal pressure? What is rib closure? I am so excited that Julie shares this with you. Also, a huge myth around hyperlordosis. So tune in for that. I sure learned some new stuff talking to Julie. This episode is meant for any yoga practitioner or teacher who has been pregnant, who plans to be pregnant, or who really wants to help the pregnant and postnatal yoga student. Of course, all of our show notes are ready for you over at theconnectedyogateacher.com/134. And there you can find all of the links that we talk about, along with clickable timestamps, so you can easily go back to a really specific topic in each and every episode. Now, before we dig into today's episode, I want to say a huge thank you to Demi Perry Yoga from Canada. You took the time a while back to leave a review way back in April, a 5-star review on iTunes, and I want to share it with everyone. So thank you for doing this. Demi says, although a seasoned yogi, upon exiting YTT, I had more questions than before beginning. I had gone from having a clear path to being lost in the woods. Shannon's podcast and accompanying Facebook group have helped me to navigate entrepreneurship within the yoga industry. The Connected Yoga Teacher content spans a variety of topics and is helpful to those both new and old. The community and resources that Shannon has built are both accessible and welcoming. Sans fluff. Unlike other podcasts, you don't have to listen to 50 minutes of chatter to get 5 minutes of substance. It's well-researched and edited so that it's substantial. I'm grateful this podcast exists, and I'm glad to be part of the Connected Yoga Teacher community. Thank you so much for leaving this review, Demi Perry Yoga. This means a lot, and I love that you have pointed out the sans fluff. For anyone who doesn't know French, sans is without. I think a lot of people know that bit of French. This is really important to me. I know that your time as a yoga teacher is super valuable and that you are doing so much out in the world. And I really do want to try and cut down the fluff, condense things as much as possible, get the answers that you need in each and every episode. So thank you for saying that that's how you feel the content is. If you are listening and you have not left us a review yet, it just warms my heart when you do take the time to leave a review. I know what it's like. I'm an avid podcast listener, and sometimes I'm just listening to my episodes and never leaving a review. I want to tell you that 2 things happen when you leave a review. It's like the best gift for any podcaster. Also, you will likely get a moment of fame because I like to read 1 testimonial each and every week. If you are wondering, how do I leave a review? You can go to our Facebook page, go to the Connected Yoga Teacher. Make sure you're on the page and not in the group. The Connected Yoga Teacher group is our group just for yoga teachers. The page is for everyone, and you can leave a review there or leave a review in iTunes. There are a few more steps, but right from our show notes page, you can leave a review. There's a button at the top. Before we dive into talking to Julie about prenatal and postnatal and pelvic health and myths, let's hear our hot tip of the week from the team at Schedulicity.
Hi, Connected Yoga Teachers. This is Chelsea from Schedulicity with a hot tip of the week. Schedulicity's package management add-on is a great option for yoga teachers. This allows you to create an incentive package with a discount that can add value to your students' visits and help ensure their return business. If each one of your classes costs $10, you could create a 5 for $40 package and offer it online. Then, when your clients are booking a class, they'll see this option. Payment is required upfront for packages, so you'll be paid and they'll have a great reason to come back. Maybe 1 5-class package is all they need to turn their yoga practice into a habit.
Thank you so much, Schedulicity. I just heard some exciting news. I heard that if you are a US yoga teacher, Schedulicity now has their own payment processing thing. Like instead of using Stripe or PayPal, and it's a much lower fee. So I want to hear from you. If you are a US yoga teacher who uses Schedulicity, tell me what it's like. Tag me in an Instagram post or a Facebook post or send me an email. I want to hear about it. I don't get to use it because I'm Canadian, but I really want to hear from some of our US yoga teachers. Alrighty, Connected Yoga Teachers, let's dig in and meet Julie. So Julie Wiebe is a physical therapist with over 20 years of clinical experience in both sports medicine and women's health. She is also an educator and women's health advocate who's really working to create awareness of pregnancy recovery, postpartum, and pelvic and abdominal issues in fitness. This is really important. I love how Julie is talking about recovery from pregnancy and also how to return to high levels of fitness when you want to. She's not saying, oh, well, you've had a baby, so now it's time to sit around and rest. She's really saying, okay, how can we get you back to doing what you love to do? If you're in the Los Angeles area, that's where Julie is working. She has a clinical practice there. She's also an author and she has tons of articles online. Honestly, we are going to leave a link for her website in our show notes, and I would highly recommend checking that out. So let's dig in and meet Julie. Welcome to the Connected Yoga Teacher Podcast, Julie. It's great to have you here today.
Oh, thank you so much for inviting me to come.
I'm really excited that we're going to dive in and talk about some pelvic health, really specifically to prenatal and postnatal today. But before we get there, tell our listeners who haven't heard of you, what is the work that you do and who do you do it for?
So I am actually a sports medicine physical therapist, but I have a real passion for pelvic health and pregnancy and postpartum, specifically as it relates to a return to fitness. So my patient population is pregnant postpartum women who have pelvic health needs and musculoskeletal needs, which means like aches and pains. And then they also have performance needs. So performance in this case would be being able to do your yoga in an unlimited way, either limited by pelvic health or limited by pain. My goal is to get you back to doing whatever it is that you love and to create programs that have meaning for you so they utilize your yoga or your Pilates or your running as your fitness, not only your fitness program, but your rehab program. So my focus and my target is on women who want to do that, to get back to what they love.
Right. And it's interesting that you use the wording rehab, because a lot of the time I hear the message in society like, oh, birth is natural. And so maybe some people who haven't given birth to a baby, or I would say people who haven't birthed a baby yet, do you want to explain why there's a rehab to pregnancy and giving birth?
Yeah, I think one of the things to kind of process is it's change. There are changes that come because of the pregnancy. And it seems obvious when you say it like that, because when you look at someone pre-pregnancy and then you look at them at 8 months pregnant or 9 months pregnant, those are some big changes. But those changes, they create, I think the way that I like to describe it most is it sort of changes the balance of your system. Like your tummy is now longer, like the musculature is longer, the way that you interact with your pelvic floor, which is the muscle inside your pelvis, the way you breathe. Like there's just a lot of things that change because of the process of pregnancy. And you have to create compensations around how you move and get through space and do your yoga or run or lift other children or laundry baskets or briefcases. You have to create some changes in the way that you move to compensate for all the changes that are going on for you physically. So those changes aren't necessarily damage or pathology, but they are changes that are appropriate for that season. And when you're done, you want those changes are no longer, those new habits, those new compensations, they aren't necessarily appropriate when you don't have a baby inside your belly anymore. So those changes can sometimes lead folks to difficulties. Postpartum, that can be low back pain or hip pain. It can be leaking, or it can be other kinds of postpartum problems. But then there can also be issues related to delivery that need more specific interventions. But so for me, what my job is to help you kind of rebalance those changes and get you back to function and fitness without any limitations. So it's really to rebalance the changes and compensations that came so that you could get across that finish line and have a baby.
Right. So do you normally recommend that people see you prenatally then as well as postnatally?
I would love that. Love it. I'm actually finally, because I've been at this a really long time, I'm finally getting women coming in before they even get pregnant, like recognizing that changes are coming, trying to be sure they're using their bodies in the most efficient, effective way to be able to maintain fitness or maintain health during their pregnancy. What do I need to do different? How do I need to move? Like what can I be doing? And then within pregnancy, I love seeing women while they're pregnant, help them learn how to kind of stay on top of the changes, and keep moving, keep exercising, and then know best how to deliver as best we can, optimize all that. Basically that optimizes their outcomes. But there's so much we can't predict. We don't know if you're going to get on bed rest. We don't know if the delivery is going to be complicated. We don't know if you're going to go by C-section or vaginal. Like we just don't know so many things. But we can optimize all that if we work together during pregnancy. And then I usually have people right out of the gate knowing what to do postpartum, and then we can work together. So my favorite is, it's just brand new that folks are finally coming in even before they get pregnant. Like that's dreamy. That's dreamy for me.
That's amazing. Where is it in France that women see a PT, like a pelvic floor PT 11 times, is it? Prenatally and postnatally?
You know, I didn't know that they do it prenatally too, but I do know for sure it's post.
Okay.
But that's just, I may not be aware of it. So, but yeah, but the interesting thing is we also need to look at what it is that they're receiving, because some of the statistics in France aren't really that much better than they are in North America for pelvic health, specifically for incontinence. So that I'm aware of. So it's sort of interesting. They do have that, and there is recognition around that there, but I need to figure out why that is, like what's going on there. So, but anyway, yes, we need in North America, Canada, US, we need to be creating some kind of standardized postpartum care for women, and it just doesn't exist. So we need some help. You guys at least have great maternity leaves.
Yes, we do. Ours is now 18 months here in Canada.
I know. I just wrote a paper on that for my doctorate, actually.
I wonder if then we have less pelvic health issues than other countries with.
That is something that would be so interesting to investigate, because there is actually statistics around, I would have to pull it up to give you the exacts, but we actually know that rehospitalization for infants and the moms or mental health consults for moms, there's a 50% reduction in that if maternity leave, paid maternity leave, if you get paid maternity leave up to 12 weeks, if you have, so there's a 50% reduction. And then, oh shoot, I just wrote this paper. And then it's something like a 75% reduction if you have more than 12 weeks or something like, so, and in the States, we don't even get, there's a lot, and there's a lot of women who don't take any because they can't afford it. Their jobs aren't protected. And often those are some of the women that are already in, culturally and racially, there's a lot of health disparities here in the US. It's tragic what's going on here. And, I know for me, my own recoveries, it sucked. It just sucked to go back to work as quickly as I had to. And my Canadian sister-in-laws were like, come have babies up here. What are you doing? But what we don't, so we know that the infants have better health. They are there's less rehospitalization, and the moms are healthier. And you just think that's got to have downstream effects. Like it's just got to have downstream long-term effects, for babies and mamas. And we actually know there's less depression amongst women. This is another study, if they had maternity leaves, down the line. So just stuff like that, but I don't know that we have an actual study regarding pelvic health, like what that pelvic health improvement is. I do interact a lot with the Canadian pelvic health community, and I know that they're working just as hard as we are here in the States to get education out, like with podcasts like this and opportunities. So we have a long way to go, but I don't know of any statistics on how it affects pelvic health specifically.
Right.
So,
I just heard of some country. I want to guess that it's Bolivia, but I have no idea. That has a 3-year, an option for a 3-year maternity, and they have to protect your job. You have to be able to go back to your job. I just don't understand. They must need a lot of new babies wherever it was.
They're supporting the birthing of babies. Yeah, and that's it. I actually saw something that was talking about, and for this paper, it was actually how Canadian businesses, how they absorb the impact of having to maintain a job and find a replacement. And it's struggle. It's hard. Like it's a decision culturally that the US, we're a mess down here. It's a mess. But culturally there's a decision that's been made to support family and pregnancy and women. And the downstream cultural effects, they're going to be there. You know what I mean? But I heard someone saying, in some of this investigation, that it's not that don't look at it as an expense, look at it as an investment as a business person. Like if you're offering this to your women, and women are now making up more and more of the workforce, like
it's going to pay off. Yeah,
it's going to pay off. They're going to be loyal. They're going to be a hard worker. You know what I mean? Anyway, this is probably not why you asked me on this podcast. But
it's a super important
it is so
topic.
important. Yeah, it is. And it's so interesting. Like what would we see down the line with pelvic health, knowing that women had an opportunity just to recover, period, just to recover physically, let alone mental health wise, or, and care for their kids and not be rushed back. And
yeah. Amazing. So looking at, in terms of what I know as a yoga teacher, I used to specialize and teach prenatal yoga. Now that's moved into pelvic health, and that was a really easy transition.
Yeah.
And so it is that prenatal time where we see yoga students more so than the postnatal. So postnatal people are usually very busy taking care of babies and, like you said, doing the recovery or getting back to work. So prenatally, if we have prenatal yoga students coming into our classes, what are some of the things that you would want that prenatal student to know or that prenatal teacher to know about that changing body? And like, here are some things to keep in mind.
Let's see. That's a great question. I think that if I could do anything for anyone, like if I could do one thing, it would be to optimize their breathing. And I think speaking to yogi and yoga people, that's a really easy conversation to have, but it's because breathing has such beautiful connections with so many of the issues that are changing during pregnancy. It is how we can access central control. Like the breathing is connected with the way your abs are functioning. It's connected with how your pelvic floor functions. They work together to help you create central control over your body. It helps to control your trunk and your pelvis. It has to do with your gut health. It has to do with your continence. It has to do with your emotional health. Like there's so many pieces of the puzzle that breathing affect. So for me, when I see someone prenatally, I'm always working on optimizing their connection to the ease of their breath and the use of their breath to connect the pieces of the puzzle. It also helps as a pressure regulator, breathing. And pressure is sort of, you can either look at it as your enemy as a woman, because it contributes to things like diastasis and prolapse and incontinence, or you can harness it and understand that it's a part of how we actually create stability at the center or control at the center. And so teaching women how to utilize their breathing to regulate the pressure, to use the pressure, and to counterbalance that with muscular work would probably be one of my priorities. If I could only do one thing, and that's what I do a lot. So yeah, that would be my
Number one.
Yeah, it would be my number one, because it affects so many things, and so many women come in with lots of issues, and that's the one thing I can do to connect all those dots.
So what are some of the things when you say that we can focus on breathing? People might be listening to this and thinking like, well, we're all breathing. So,
sure.
So how is it
more
that
specific?
you teach people how to optimally breathe then?
So one of the things that, let's see, I'm trying to think of a good example that doesn't require a visualization, is the movement of the rib cage. Let's just start there. So as the baby grows, mama's rib cages tend to, I think of them as bells ringing off the shoulder girdle. So mama's bells often sort of broaden the rib cage, and it often tips kind of up and away from the baby. And so that sort of changes the dynamics of the way the diaphragm is acting. It changes how that diaphragm is moving. And so helping mamas as best they can continue to get the ribs to open and close. The closure is the key. And that closure isn't forced, like using your abs to pull your ribs down, using your abs to pull the rib cage together. It's actually through, you can utilize a really, just breathing out and using things like holding your lips like you're blowing out birthday candles, and giving a really long exhale to help yourself feel the ribs coming back in. Like it's supposed to be this passive process. But in so many circumstances, this is true for a lot of my yogis. I'm in Los Angeles with tons of yogis around here. There's sort of this imposed, like really big, harsh breathing. And it's really meant to be this gentle, beautiful, passive process to get the air back out. So kind of relearning how to just let the breath lead the way and let the ribs go in and out and in all the way, helps to keep the pieces of the puzzle connected. Oh my gosh, I hope that was an okay answer.
That's an amazing answer. I actually never thought about the change. Well, obviously the changes, I know I had 3 babies. There's like space gets taken up pretty quickly. Everything else gets pushed up in, but I never thought of how this affects the exhale and that movement of the ribs.
Yeah. And the thing is a lot of people will tell you can't do anything about that during pregnancy because the baby is so big. But I would suggest that you can, because I do it with my patients. There is sometimes alignment shifts that help to create that ability to get them back in again, but it sort of gets forgotten. And it's sort of a piece of the puzzle, like you said, like you're not even looking for that. But what it does, if you don't exchange the diaphragm length, if you don't exchange that ability, I'm making hand motions that no one can see, but if you're allowing the ribs to come in and out, you're exchanging pressure, you're creating even just the location of the abs, like the abs hook onto your rib cage. So when we talk about something like diastasis, if you're always sort of breathing shallow with your ribs already in kind of an inhalation position, the abs are there too. They're sort of in this position out here. So if you're actually getting that really nice exhalation and your ribs are gradually coming in, you're actually, the tummy's going to come in too. Your separation will be smaller for that moment in time. So it just sort of connects all those dots, and it's something that we sort of don't really pay a lot of attention to, but rib closure is a big piece of the puzzle for a lot of my mamas to help them really start to experience again what that feels like to get a full breath. Because most mamas are like, oh, I can't breathe. And it's because that they think the belly's in the way, but we can actually put you in a position and then help you really start to feel that again. And once they feel the end ranges, the brain loves to breathe well. And so it starts to put that back into their baseline. Right. So that's sort of that's a piece of the puzzle that I like to work with all my patients, because the exchange of pressure too will also reduce what they're using. It sort of creates an opportunity to keep using that system well. If they don't have that, they have to go to gripping the abs or holding their breath or gripping their pelvic floor to get through their movements. But if you're actually kind of exchanging the pressure, exchanging the muscular work, getting things moving off of that breath cycle, we're keeping everything moving and lubricated. That's like all working together, as opposed to having to rely on faulty strategies like breath holding to get through your day or gripping your abs all day. I don't know. I hope that makes sense. I hope I'm making a lot of hand motions that no one can see.
I love it. So you also touched on, I wanted to ask you, you said you get them into a pose. Is there can you talk us through what that pose looks like? What you feel is the best one to get into that closure of the rib cage?
So for a lot of my mamas, what I call it is ski jump. It's not like a yoga pose. It's really kind of leaning forward from the ankles, and it slides the rib cage over top of the pelvis naturally. And the reason that it's important for it to be more passive and natural is because if mamas spend time gripping their abs to try to pull the rib cage forward, they interrupt their breath. So you kind of can't have it both ways. Like a lot of people will cue, pull your TA to your spine, or, brace your abdomen and now breathe normally. You kind of can't. Like if everybody right now grabs their abdomen and pulls in tight and then tries to breathe, you can't breathe as well that way. So allowing the abdomen to relax is part of the breath cycle. It's part of the inhalation component of breathing. So when I ask people to lean from the ankle at an angle, they're getting that rib cage to sort of gradually find its way over top of the pelvis. And that basically brings the rib cage into a position that optimizes that diaphragm length, and it gives them access to it. So it's not meant to be how you obviously spend the rest of your days until you deliver. Like it's impossible, but it's really to give your brain access again to how to utilize that diaphragm and find that breath. And then we move back towards more of a mid-range position and hope that they can continue to find it there. So it's sort of that form change for me is what I call the ski jump. And it's just an easy way for people to start to feel things a little bit different. Like, I don't have to be in this extreme position. I can breathe better here. And once they find that breath, that's their cue for an alignment that keeps supporting it throughout the day. Find your breath, find that ease of breath. So I hope I'm making sense. I'm sorry, I'm making so many hand motions.
It's great. I was doing an episode the other day and I was like, okay, here we go. Like I'm going to try and explain this pose through audio so I completely understand. Yeah. This ski jump pose is really similar to something that I learned in the hypopressive technique.
Mm-hmm.
Yeah. So,
I've heard someone recently told me that. So,
yeah. Yeah, it's in there. Just that it helps the transverse abdominis to engage is one of the key factors in that. So it's interesting that it's there. What I wanted to go back to was you had said alignment. So do you want to talk about what happens? I'm guessing that's one of the changes, or that definitely was in my pregnancy,
Sure, yeah.
where baby, all of the weight started to move towards the front of my body. And so how does that affect like the lumbar curve and the alignment? And what are some of the things we can look at when we bring our students to standing?
Yeah, actually, one of the major things that I teach is that we focused way too much on the lumbar curve, and that we actually have ascribed anterior tilt to all pregnant ladies, that everyone has a hyperlordosis and an anterior tilt. But the reality is that ribcage position, which is not something we've been trained to really look at in most trainings, is actually tricked our eye. And again, this is really hard to show visually through audio, but I'll give you a quick clinical sign that I use, which is called the elbow sign, which is my ridiculous name for this clinical tool that will never make it into the literature. But basically, if your patient or your client's arm is at their side, and if you're looking at their back and the apex, so the deepest part of their lumbar curve, and I said lumbar in quotes because if it is at the level of the elbow, that's actually the TL junction. So that's where the thoracic and the lumbar vertebrae meet. So everybody can do this. If you put your arm at your side, you feel where the elbow touches, and it touches at the bottom of your rib cage. And so anatomically, that's about the same in and around where the thoracic and lumbar junction is. And the reason that's important is that's not where the apex is supposed to be. But what's happened for a lot of our mamas is that that's right where they hinge to get out of the way of the baby. So that becomes their hinge point. And so what beneath that becomes a shallower, the rest of the lumbar curve is actually much shallower, and their bums are more tucked under. And I know this just sounds crazy, but it is actually, so you can't have a tucked under bum and have a hyperlordosis. Like you can't have both of those things. But it looks that way. Like if you look at them, you think, well, they're hyperlordotic, anterior tilt, but their butts are tucked and their lumbar spines are flat. The junction is actually higher, and it's a rib cage tipping that people are seeing. It's tricked our eyes for years. And it creates shallow breathing and upper chest breathing, which we all know is not something we want. So, I mean, and I can give you some pictures to sort of help kind of elucidate this. I don't know if you want to add those.
Yeah,
might
I
help
can
a
add
little
them
bit.
to the show notes. Yeah.
Yeah. So it's actually, so that's a really big deal in a lot of sports. And I don't know if it's a big cue inside the yoga world, but there is a lot of fixing anterior tilt. Like if you Google fix your anterior tilt, it's really problematic because these women aren't in anterior tilt. We're visually making that assumption, and we're saying that about pregnant ladies. Like we just keep saying, oh, all pregnant ladies are anterior tilted. They're not. We actually have one study that has shown us that 11 out of 15 pregnant ladies, not a huge N, but it is what it is. Sorry, that was my dog.
That's okay.
That 11 out of 15 women had flattened curves and posterior tilt, like out of these pregnant ladies. And so this assumption that we've always made is not correct. It's this rib cage tipping that is really where we're getting what we're seeing. And then when you fix someone's anterior tilt and you tell them to tuck more, you're putting them in a position that is less sufficient for the pelvic floor to be responsive. And so we end up seeing more pelvic health, like leaking and things like that, when women are tucking even more, and they're losing their glute access, like, because form or alignment for me has a lot to do with access to muscles. And so when you fix their anterior tilt, they're actually creating less access to components of the system that they need to help them protect their pelvic health.
So where do you start with that then? Do you start at untucking the tailbone, or do you start up at the ribs? Or
I start at, so I think of it like a Ginga puzzle.
Okay.
So, because if you think like you pull on one side of the Ginga, you got to pull out the other side of the Ginga. So that little crazy ski jump trick, when you lean forward and it's from the ankles, let me just be super clear. It's not bending at the waist. It's sort of a lean from the ankles. What should happen and what tends to happen is that the rib cage glides forward over the pelvis and the pelvis naturally untucks a little bit. And that's where I help women access breathing a little bit different, and then also their pelvic floor too. So if you're standing there and your weight is sort of in your heels, you may feel that when you do a pelvic floor contraction, you feel more work around the anus. But if you lean into this like ski jump kind of position, so I mean, and that's that visual of people that do the crazy ski jumps, in the Olympics. If you're leaning forward and you try to do a pelvic floor engagement, you should feel more around the front of the pelvic floor. And so it gives women access to that front half. Like most women are like, I can stop a fart, but I can't stop a leak, right? And it's because they feel and they have success accessing around their anus, but they don't know how to connect again to the front half. So that ski jump is sort of my trick that puts the pelvis in a better position. It creates demand over the front of the pelvis. Like you got to feel, there's got to be some sensation there. So that kind of just not pushing, but giving them that opportunity to have their weight shifted forward gives them some access to the front of their pelvic floor, and they feel it for the first time. And again, so much of what I'm suggesting is more reintroducing and reintroducing all this to the brain. Like, remember when we used to breathe when there wasn't a baby here?
Right.
Like, let's go back to that pattern. Remember when the abs actually did what they were supposed to do? Let's remember that. What about when the pelvic floor? And now let's make them all work together as a team. And then that's how they've always worked. Let's reintroduce that, rebalance that, recoordinate that. And that position helps me give women access to that system again. And then once they found it, the brain's like, oh, cool. I remember this. I'm in. Let's use this system again and breathe better and use the pelvic floor better. And let's integrate it into meaningful movement, which for your audience is yoga. Let's do that. And then that sort of helps reinforce that system. Does that make sense? So that's sort of where I go. So that kink, that rib cage position is, I'm going to say corrected, but that's not really the best word. It's altered and changed back when the breath changes, because it will sort of alter how they're finding their stability. Right now, the stability is coming from that junction, and that's not really where it's supposed to come from.
Right.
So,
okay.
So it's really creating a new thing.
Many questions now.
Okay.
But two main ones. I want to get forward, I want to go into, because you've touched on a few times about leaking. And I feel like this is the time in our lives where things really change around incontinence and leaking urine. So we'll come back to that.
Okay.
But one curiosity question, because we're talking a lot about the breath, is someone told me the other day that they were told to strengthen their diaphragm.
Okay.
And then sent home, with no...
instructions? Oh.
And I was like...
I can help.
Okay.
There is... So we have Inspiratory muscle trainers now. You can buy them on Amazon. They exist. We have good research around it. We actually... and there's some really good research around performance and inspiratory muscle training. And so it's literally like you breathe against resistance. These little...
I think I had to do this after my cesarean, push out, and you had to make the little balls go up.
No, it's a little bit different than that. It's actually inhalation. So you were doing exhalation to be sure you got your anesthesia out and everything was cool, probably, I'm guessing.
Maybe.
But inhalation. So it's asking the diaphragm to work against resistance. So, there's good literature around that. I've used it with a couple of patients myself, but they had neurological complications, post having strokes and things like that. Mm-hmm. And so they actually had true, diaphragm involvement that was neuromuscular. But so there is a possibility that would be something that could be positive in the postpartum population. I just don't have any specific research around that, but we do have a lot of research in and around performance, a lot of swimmers, things like that there's positive it's a curiosity for things like asthma, cystic fibrosis. We actually have good research around it for GERD, which is a big problem for a lot of people in the postpartum population.
Do you want to define what GERD is?
Oh, sorry. That's like reflux, esophageal. So when your gut contents come back up into your throat. And so we actually have a couple studies that have looked at using inspiratory muscle training to affect GERD positively. Oh. And then if medicine is not your thing and you want to try that, there's been some positive results from that. So, and again, you can get them on Amazon. Like I don't know if I'm making a medical recommendation.
Right. Go see your pelvic floor physio first and see if you need to do that. Yeah.
Yeah. But they're over the counter. Like it's not, and it can't hurt you. You know what I mean? Like if you try it and it doesn't change your symptoms, then, it's a $15 investment, to see if maybe something would be positive.
Right.
But I don't know of anyone who's using it necessarily as a part of their regular treatment of people with pelvic health considerations. But again, I've used it with a few of my patients, but who had more specific issues around GERD or they had neurological complications. And there are people, anyway, yeah. So that's what that is. But I'm surprised that they were like,
go do this. Strengthen your diaphragm.
Google it. Google it. Good luck.
Okay, so on to incontinence or leaking urine. We'll focus on leaking urine because I feel like that's more common in the prenatal, postnatal. How do we know when it's okay to leak urine? Someone told me, okay, it's fine up to 6 weeks postpartum, and then after that, it's not.
I don't know that I've ever heard that specifically, to be honest. I would say, I've never actually heard anything like that.
Okay.
So
maybe
I'm trying to think, how do I respond to that?
Well, I wonder if the response is like, if you're leaking urine, then you need to look at it no matter how many weeks postpartum you are.
Well, I guess my thought would be, so I think this is where we're running into a little trouble. I know we talked a little bit off the mic for regarding social media and some of the information out there, is that we need to be really careful about stuff like at 6 weeks, this should happen. And after 6 weeks, this should happen. You know what I mean? Like now, I think we need to be super careful on that because I would have about a litany of questions. Are you leaking just getting out of a chair? Are you leaking when you cough, sneeze, laugh? Are you leaking when you lift the baby? Like what's creating the leaks? So there are people out there, this is not necessarily postpartum women, who just leak. You know what I mean? Like they just walk around and leak. So are you leaking overnight? Are you getting up a lot to go pee? Like I would have a lot of questions, and some of it I would be like, let's let hormones settle down. Let's talk you through like some of that pressure management. Like let's breathe before you pick up the baby. That'll sort of give you some relief from the pressure down. I'm going to give you strategies so that when you pick up the baby, you can use your muscles better so that you're not holding your breath or gripping your abs. And that might be what's making you leak to lift your baby. Like, let's have better strategies for that. So I wouldn't necessarily panic, or I don't really panic about any of this stuff, to be honest. But I would be like, let's sort of sort out what it is that you're doing, what's creating the problem, and then let's find a strategy that matches that demand a little bit better for you, like that. So whether it's 6 weeks or 10 weeks or 6 months, 12 weeks, whatever, like I guess, I don't know. I just need to process a little bit about why
there's a time. Well, I love how you said it's more about the individual. It's not like there's no one answer. And I guess the message that I would love for people to know is sometimes I will hear from people, well, it's because I had babies and I'm aging, so it's just normal that I'm leaking urine. Right. So what would you say to that?
I would say, I think there's maybe some new information out there that yes, that is kind of what we've said culturally for a really long time. But we've got some new ideas and some new strategies out there. And I think that it might be worth investigating if you're interested. Like we can do more than maybe what you've heard in the past. We just have a lot of cultural embedded myths that we need to sort of undo out there. And that's one of them that I think, so in opportunities like this to talk and get it out there, and using platforms like this, I hope will help. I don't know the ages of the demographics of your listeners.
Right.
But yeah, like there's sort of you had a baby, your body's going to fall apart. And that's just one of the ways it falls apart. You just have to live with it. But that's just not true. And I think that we have a long way to go, but we've made a lot of headway to help dispel stuff like that. I hope.
Yeah.
I don't know. Yeah.
As soon as a student will say to me like, oh, well, I can't do that jumping thing with my kids anymore. That's just the way it is. Well, after you have kids, I always say to them, no, it doesn't have to be the way it is. If you want to go see your PT, who specializes in pelvic health, and they can give you a lot of tips and tools. I want to talk about some of the other myths. Stop me if you think of other ones. One of them for sure is the whole conversation around Kegels. Like, you have a baby and then you do Kegels. Do you want to address like how that is not always the answer?
Yeah, well, I mean, I think if we define Kegels as just pelvic floor contractions, unfortunately, here's the deal. They have their place for sure. They have a place for helping us identify where the pelvic floor is, to start to get reconnected with it. But the more we learn, the more we understand that the pelvic health system, the continence mechanism, is not the pelvic floor alone doing the work. And so, it works with teammates, and one of them is the diaphragm and breathing, and the other is the abs. They work together. So where we run into trouble is for some women, if they're having issues where they already are recruiting their pelvic floor too much. If you ask them to continue to do just pelvic floor strengthening, like if we sort of similar to the 6-week thing, like at 6 weeks, you got to do this. You had a baby, you got to do Kegels. If your pelvic floor strength may not be what the issue is. It may be that we need to rebalance the diaphragm, the pressure, the abdomen, and the pelvic floor, and get them working together as a unit. That's sort of the way that I operate. And that rebalancing those components is really where we're headed. Kegels are important, like giving you some access, but the over recruitment of the pelvic floor, maybe let's say a woman whose ribs are really wide and she doesn't know how to use her diaphragm well, and she's breath holding, she might be gripping her pelvic floor because she doesn't have a better strategy for fighting gravity. And then if you tell that gripper, let's just do Kegels, she may end up with constipation or hip pain or painful sex or urgency, like she feels like she has to pee all the time. So we need to start appreciating that it's more than just the pelvic floor that contributes to these things. And we need to look at how the whole system is working, so that we can give appropriate recommendations on whether or not you need pelvic floor specific strengthening, or if you need to learn to balance out your pelvic floor and access it in different ways, based on how you're meeting your demands or the strategies that you're using. I hope that's making sense, and that's answering the question you were gunning for. But yeah, we need to just start looking at individuals and understand their needs. And that's tricky. Like, it's way easier to be like, just pull your navel to your spine, just breathe, just move. You know what I mean? Like, but we need to actually sort of pull back some of the layers of the onion to understand why. Why is a woman overusing her pelvic floor or underusing her pelvic floor? Or why is she breathing like that, or standing like that, or using her tummy like that? What do we need to change? Because for whatever reason, they're not meeting the demands of their day. That's why they're seeing us in rehab, right? Like, they've come to us for a reason, and something's not working well. Like, our job is to figure out what's not working well and help them find their way there. So anyway, did I answer that question okay? You
did. You really did.
Okay.
I'm thinking now as a yoga teacher who sometimes works with prenatal yoga students, as kind of like a summary, I'm seeing that we're going to look at how the rib cage is not only expanding, but also closing in. I'd say adding in this ski jump would be really nice. Like this ski jump movement into a yoga class, that's super easy to do.
Yeah.
Also not focusing on that lumbar curve the way maybe we were.
Yeah.
And by doing the ski jump, we know that we'll bring them out of that in a nice way.
Mm-hmm.
I would say, and you can disagree with me here or correct me or add to it, I don't cue pelvic floor engagement in a group class, or I just leave that up to the pelvic floor physical therapists and physiotherapists. I feel like I have no idea if someone's engaging their pelvic floor in the proper way or how they're doing it or if they need to be doing it. I feel like it's out of my scope of practice. Are there any other things that you can think of that you would love for yoga teachers? I mean, another one that I love to do is bring a PT into class and say, like, ask your questions. Here's the time. Is there anything else that we can be doing to help our students in terms of movement or breath or information?
I think, let's see. I think it would be really valuable. Let me just say this. Let's start here. If you have not had babies, now is the time to figure out your baseline, which is why I love that I'm starting to see women before they go get pregnant. So take a mirror, check it out. Look at what your vagina looks like. Get your baseline diastasis. Like, you already have one. Like, everyone does, okay? Everyone has a little bit of a separation between their abs. It's the way we've been designed. So find out what your baseline is. You know what I mean? And then understand how to make your pelvic floor work. Like, and it can be as simple as sitting over top of a towel and feeling it relax. See if you can feel the towel, touch the towel, feel if you can feel your pelvic floor lift away from the towel. Put your hands on your abdomen. When you take a breath, your tummy should relax a little bit. And on exhale, it should tighten a little bit. Like, just start to get to know your body and understand how it's interacting with the components of the system. What does your breath look like? Are you breathing up? Are your shoulders moving to your ears every time you take a breath? In yoga, you may be gripping your abs all the time and your diaphragm can't go down very well against that pressure. So you're breathing up all the time. So changing up your breathing so that when you inhale, your tummy gives. The pelvic floor follows the tummy. So that would be a great thing for yoga teachers to be able to observe. Like, if your client's tummy does not move, there's a problem. You know what I mean? Like, that system is being kind of like the way that system is intended to sort of work together is being interrupted because we've told people grip your abs all the time. Right. So there's pieces of that puzzle, like, try to start to understand how your body's using this system. And I think there's value there. And particularly if you haven't had a baby yet, it's a great time to figure that out. And then if you've already had a baby, you may have more or less connection with pieces of this puzzle because of what's going on. Like, for some women, they're like, oh yeah, I can feel my pelvic floor because I remember what it felt like. But for some women, they lose some sensation down there. So there's just a lot of pieces of the puzzle. Like, I'm going off onto a bunch of tangents, but I think that it would be valuable for women to start to appreciate that this is just part of their health, and to start to seek out, if they can, someone in their area that has some pelvic health experience, but they can palpate it themselves. I encourage people to put their hands, like, you can do it externally through pants. Just feel what your pelvic floor is doing. When you think you're lifting it up, do you feel it rise? Like, can you feel, and if you relax, do you feel it come into your fingers? Like, this is your body. You know what I mean? Start to understand what it does well and what you can improve on. And because none of this is inevitable. Like, there's so much we can be doing. Anyway, I'm sorry. I probably went on to a lot of little.
That's great. That's amazing. I want to touch on what you're just about to say and expand on this I'll tell you what someone said to me the other day. She's never had a baby, and we were in prenatal yoga teacher training. I have a prenatal yoga school, and we were focusing on pelvic health. And we talked about diastasis and pelvic organ prolapse and all of these things that the pre and postnatal student needs to kind of be aware of, or we definitely do as yoga teachers, just to know what that is. And she said, no one ever told me this before. Like, they were just like, pregnancy is beautiful. And I felt a little bit bad. I felt like I had just
terrified
her, instilled fear. Like, can you speak to that a little bit in terms of having the knowledge? Like, why is it important that we have this conversation?
Yeah. And that's, I think, one of the most important things that, and again, this comes back to our conversation around social media, is we can provide, and one of the hashtags that my favorite thing I've ever used online is educated hope. And I think that a lot of what we've ended up doing is creating fear, educated fear.
Yeah.
And we need to be super careful about that. Because we do want the species to continue. We want people having babies, like you said, in Bolivia or whatever it is. We need it. And it's really, I think that there is absolute wisdom in women. I remember when I had my first, people were like, are you nervous? Are you nervous about your delivery? And I was like, honestly, I don't know what to be afraid of. I know that it's not easy. But I know women survive. But I also know that things might happen. Because I didn't know any of this stuff when I had my first. I didn't know any of this. And, and I remember hearing a story from this woman that I was like, I just remember being like your friend, I was like, oh my gosh. And I was already on the train. I can't get off this train. This baby is coming out of my body and I can't get off this train. So I get that feeling, but so there's wisdom in understanding, I think, the process but there are variables we cannot control. But we can optimize your outcome through helping you connect some of these dots before you have the baby. And we have tools for postpartum that can help you connect those dots again. So understanding, I do think there's value in educating women 100%. We should know about our bodies. We should know what to expect as best we can. There's variables we cannot predict, but to know that on the other side of that, we have tools to help put some of those pieces together again. And they don't have to be dramatic. They don't have to be terrible. They can be small things. But I've seen the other side of the mountain. There is another side of this mountain. You know what I mean? I've walked that path with a lot of ladies, and there is another side to the mountain. And I think if we can keep focusing on the fact that we can find our way there, it may not look like you thought it was going to look, and it may not be perfect, and it may not be your body that you had exactly when you were 14 again. Or not 14. I don't want to be 14 again, but maybe 21.
Right.
Yeah. But it's not going to be the same, but it's going to be beautiful. It's still beautiful, and it's done amazing things. So I know what the other side of that mountain looks like. And so that's the hope we need to provide for women. And that's what I hope the education provides, not complete, utter fear. I did it twice. You did it 3 times.
Yeah, I know.
We knew what was happening the second time. Yeah. I knew it was coming. And my second delivery was harder than my first, but it was worth it. At the end of the day, it was worth it for me. So,
yeah.
Well, that's a tough one, but we need to be careful. Yeah.
Yeah, we do. It's a balance of telling the stories, having the empowering stories as well, and the information rooted in science and our knowledge, and not just listening to just one person. That's so good.
Yeah. But we are seeing more and more that women, we have studies now that women really need to have voices. They need to know what they can ask for and be powerful around in the midst. So I don't know. There's a lot. We got a lot of work to do for women, but
yeah. Especially do you mean around birthing and asking for what we need when we birth?
Yeah. And just that a lot of women don't they get poorly treated, and, blog is coming, but it is, I have a half written blog in my head, but
good.
Yeah, we just need women. Yeah. It's natural. But it doesn't mean that it's easy, and that women can't be really well cared for in the midst, both in the midst and after. We need to start making that standard. And all over the world, we need that for everyone.
Yes,
yeah.
I totally agree.
Soapbox.
This has been amazing. I've learned so much already. If our listeners want to reach out to you and see your wealth of articles and videos and resources, what's the best website for them to go to?
You can go to the website is my name. It's Julie Wiebe, which is tough, but it's JulieWiebe. It follows the grammatical rule. JulieWiebePT.com. If you misspell it, you'll get there too, I've discovered. I have lots of resources on there for both women, individuals, and for professionals who are interested. And I do have a newsletter. I'm sort of taking a little break from social media as I get my doctorate. So if you do want to keep up and get new blogs and things like that. I have a newsletter that you can sign up for on my homepage. So,
all right. Thank you so much. That's amazing.
oh, it's my pleasure. Thank you so much for having me. This has been great.
Thank you so much, Julie. That was a lot of information. I'm so excited to learn about a few things in this. For sure, how to really focus on that exhale and that closing in of the rib cage. I've been playing around with this. Like I said in our interview, this ski jump pose is something that I learned when I did the hypopressive training with Trista Zinn. We had Trista Zinn talking about that back on the podcast. I can't remember what episode it is, but I know Crunch will help me out and put it in the show notes. And I'm also really excited to dig into my maybe misconception or my idea before of this hyperlordosis happening in pregnancy and what's actually going on. So thank you so much for that, Julie. That was huge. Connected Yoga teachers, I would love to hear from you. What was something that you really took away from today's episode? Is there something that you're now taking into your own practice? Is there something that you're using with your students, or do you see things a little differently? I also really want to highlight one of my key takeaways here was how Julie said 2 things. Find your baseline and get super aware of your body and your breath. I love this. I hope that everyone, if you want to take one piece of homework, do that. Do the few things where Julie said, find your baseline. Also, this idea of teaching from a place of educated hope instead of educated fear. If you are able to join us in person, Connected Yoga teachers, there are 2 Mama Nurture trainings coming up. So I am going to have a little more information on Mama Nurture for you in a future episode. But the quick story is that I am teaching it once again in Meaford, but with 2 co-teachers this time. So I'll talk about that more as we go and as we get closer to that. That's in Meaford, Ontario. But also Rena is teaching the training in Arkansas. So if you want to know anything about how to become a prenatal yoga teacher with an RPYT certification through Yoga Alliance, look up mamanurture.ca. That's MAMA. That's how we spell mama. If you're not sure if you can join us in person, Rena and I are doing an online free training for all yoga teachers. It's September the 16th, and I will make sure to put a link to that in our show notes. Alrighty, Connected Yoga teachers, before I sign off, I want to say 2 things. A huge thank you to our team over here at the Connected Yoga Teacher. You really make every episode possible, and I cannot say thank you enough for how well you treat each other, and you treat me, and you treat this really important work that we're doing. Also, Connected Yoga teachers, before I sign off, I want to know what you will be doing this week to stay connected, in whatever that means for you. Maybe you want to be connected to yourself, your yoga practice, or to your community. And this connection is really so that you can share the yoga that lights you up.